Thinning hair can undermine the self-esteem of even the most confident person. There are many so-called solutions offered by many different doctors and hair restoration experts. But according to our friend Dr. Richard Shafu, a triple board certified plastic surgeon, hair surgery is one of the most critical aesthetic procedures one can have done. NeoGraft is the latest technique offered for a safe, advanced, minimally invasive alternative to traditional hair transplant procedures. And it sounded so good, I volunteered to have the procedure done on me to see just how well this new method works. Well, hello everybody. Today we're here with Dr. Shafu again. Thanks
Good
for
to
having
see
me.
you, Patrick. Thanks for
coming.
coming.
And we're going to do something on me.
Exactly.
I mean, last time we came in here, we did an amazing job. We repaired a breast augmentation. Turned out beautifully. You're one of the best surgeons in town, as we know, or if not in the world. Triple board certified. Taught us a lot. Now you're going to teach us a lot about hair transplantation.
Right. You know, the big thing about hair transplantation, Patrick, is it's a really exciting field because if you think about when a patient chooses to have an aesthetic procedure done, hair surgery is one of the most critical procedures for a patient because it's permanent. It's something you can't cover or hide. And so how you design a hairline, the team that you have that work with you, the kind of devices that you use is critical in achieving an aesthetic result. We've all seen, you know, like we've all seen bad plastic surgery. Oh, yeah. We've all seen bad hair surgery.
The hair plate looks like
and it screams. You know, exactly. I tell patients, you know, great plastic surgery whispers, bad plastic surgery screams. Nothing is more true for certainly in hair surgery.
Now, I have had this procedure done before, but it was a different type of procedure.
Correct.
And they did a great job.
I think your hairline was very aesthetically placed. I think that was a good decision. The issue, of course, we talked about a little earlier on is how do you harvest the grafts that you need, yes, and where do you place those? So the first part of that people don't think about so much, but it's as critical. How you harvest the hair is how you plant the hair. And the older techniques, unfortunately, that are still in many of the kind of outdated clinics, are the use of a strip technique.
And that's what happened to me.
Yes.
And I'm literally still numb.
Yes.
In that spot. And you said that's never coming back.
That's permanent,
yeah,
unfortunately.
I think I did it like 10 years ago or something.
Right.
Yeah.
The thing about our practice that's unique is we have the top people that do this procedure that are trained by the actual company that developed the device. Okay. So the hair team that we have are actually certified by the company. They have to have special hands-on training. These ladies have been involved in literally thousands of cases for a number of years. So you're in great hands for sure.
So I guess we get started by just trimming the back area and blending it in, because you know, you're good, right?
It's very good.
So there we go.
Okay.
Well, thanks so much. We'll be back, I'm sure,
back in a moment
to monitor this process.
Yes,
make it beautiful. Technically a form of follicular unit extraction, or FUE, NeoGraft takes hair grafts from the back of the head where hair is genetically programmed not to fall out, so they can be placed in the thinning or balding areas. Compared to other techniques, the NeoGraft procedure maximizes the use and preservation of the finite amount of donor hair available. The procedure does take some time, but Dr. Shafu's office is well prepared with Netflix and other entertainment for your viewing pleasure. The recovery time is also shorter, and the procedure doesn't leave a visible scar. Well, we're back. It's the next day. In fact, it's like not that far along. It's only been a few hours, really.
Exactly. So what we'll do now is we'll just go ahead and take off the band dressing here. It's just a little pressure dressing, really kind of for the donor site on the back in case you get a little bit of drainage overnight. Some people do. Some people do not. You can actually see that the sites where the grafts were taken with the NeoGraft, very, very small openings where the individual follicular units are extracted, but there are a large number of spaces where your normal scalp and the normal follicular units were left intact. And the reason we do that is obviously we're sparing a large area of the donor region. The little holes that were made that are literally under a millimeter, they'll just actually collapse down and the surrounding follicular units will collapse in, and so we won't see any scars. So in the frontal area here, this is where the grafts have been transplanted into the frontal, a few in the crown area as well, and you can see some small little crusts that have occurred at the base of the where we place the follicular units between that and the scalp. And so you can see these small little crust areas. Those will be gone within about a week. When that grows, basically, you'll notice that the hairs will initially may begin to grow grow for a few weeks, and then that small little hair that was with the follicle typically will just fall out, and it will begin.
Don't worry.
Don't worry,
because that's what people freak out, right?
Exactly. That's kind of what we call shock loss or telogen effluvium is the medical term for that.
When will they come back next?
And I'm going to see in about a week. We'll see how things look in a week. In about a week, most of those little crusts will have flaked off, but we'll have to examine both the donor area and the recipient areas at that point.
Sounds great. I'm excited. Well, thanks so much.
Yeah, my pleasure.
Thanks again.
That's good.
Well, we're back here with my favorite board certified, triple board certified cosmetic surgeon, Dr. Shafu, and I'm doing good, right? When I tell people that I had grafts done, they're like, you did not.
Exactly.
And how long ago? I go, what, a month ago. They're like, are you kidding me? And they go, let me see the back. They're like, there's nothing. I go, yeah, there's nothing, absolutely nothing. Like nothing ever happened.
I know.
As opposed to, you know,
the strip technique.
Horrible.
Yeah, there's no comparison between the two. And in fact, you know, the thing that's amazing about this technology, Patrick, is that really at about a week, as we saw in the earlier segment, the hair is already growing into the donor site, so it's hard to even know that anything was done even at a week.
It's crazy.
Yeah. Basically what we're looking at right now is this hairline here. You can see where the transplants have been done in a nice irregular manner.
Yes.
Look very natural, but all the crusts are gone away. But again, what we've done is just to recreate a very natural and unoperated on-looking hairline. So when the hairs grow back into the scalp, they'll be growing in a very natural direction, and he'll just have more density in that area. Then up in the whorl in here, there's the crown area. Again, we can just notice the small little areas where the grafting is being done. We can actually feel the little stubbles of the hair follicles there. But again, nicely packed very tightly and densely into that area.
The process is going according to plan. I'm very comfortable with it, and you know, I just can't wait to see the final results. And you say, once again, that's going to be fully about a year.
Yeah, about a year, 3 or 4 months, exactly.
Exciting.
Yeah, me too.
So I'll see you in about 3 months, huh?
Look forward to it, Patrick.
Yeah, and there we go. And we'll see you soon.